Acute bacterial meningitis. Pathogens most frequently involved in immunocompetent adults are Streptococcus pneumoniae, pneumococcus, approximately 50%, and Neisseria meningitidis, meningococcus, approximately 25%. Predisposing factors for pneumococcal meningitis include infection, pneumonia, otitis, sinusitis, asplenia, hypogammaglobulinemia, complement deficiency, alcoholism, diabetes, and head trauma with CSF leak. Listeria monocytogenes is an important consideration in pregnant women, individuals and GT, 60 years, alcoholics, and immunocompromised individuals of all ages. Enteric gram-negative bacilli and group B streptococcus are increasingly common causes of meningitis in individuals with chronic medical conditions. Staphylococcus aureus and coagulase-negative staphylococci are important causes following invasive neurosurgical procedures, especially shunting procedures for hydrocephalus. Clinical features: presents as an acute fulminant illness that progresses rapidly in a few hours, or is a subacute infection that progressively worsens over several days. The classic clinical trial of meningitis is fever, headache, and nuchal rigidity, stiff neck. Alteration in mental status occurs in NGT, 75% of patient, and can vary from lethargy to coma. Nausea, vomiting, and photophobia are also common. Seizures occur in 20–40% of patient. Raised intracranial pressure, ICP, is the major cause of obtundation and coma. The rash of meningococcemia begins as a diffuse maculopapular rash resembling a viral exanthem, but rapidly becomes petechial on trunk and lower extremities, mucous membranes and conjunctiva, and occasionally palms and soles. Laboratory evaluation: CSF bacterial cultures are positive in 80% of patient, and CSF gram stain demonstrates organisms in 60%. A16 srRNA conserved sequence broad-based bacterial PCR can detect small numbers of viable and non-viable organisms in the CSF and is useful for making a diagnosis in patients who have been pre-treated with antibiotics and in whom gram stain and CSF cultures are negative. When positive, more specific PCR tests for individual organisms can be obtained. The latex agglutination test for detection of bacterial antigens of S. pneumoniae, N. meningitidis, Haemophilus influenza type B, Group B streptococcus, and E. coli K1 strains in the CSF is being replaced by the CSF bacterial PCR assay. The Limulus amoebocyte lysate assay rapidly detects gram-negative endotoxin in CSF and thus is useful in diagnosis of gram-negative bacterial meningitis. False positives may occur, but sensitivity approaches 100%. Petechial skin lesions, if present, should be biopsied. Blood cultures should always be obtained. Cerebrospinal fluid, CSF abnormalities in bacterial meningitis. Opening pressure. White blood cells 10 per microliter to 10,000 per microliter. Neutrophils predominate. Red blood cells absent in non-traumatic tap. Glucose 0.45 grams per liter. Grams stain positive in NGT 60%. Culture positive in NGT 80%. Latex agglutination may be positive in patient with meningitis due to S. pneumoniae, N. meningitis, H. influenza type B, E. coli, group B streptococci. Limulus lysate positive in cases of gram-negative meningitis. PCR detects bacterial DNA. Antimicrobial therapy of CNS bacterial infections based on common pathogens causing the disease. Neisseria meningitidis. Penicillin sensitive, penicillin G or ampicillin. Penicillin resistant, ceftriaxone or cefotaxime. Streptococcus pneumoniae. Penicillin sensitive, penicillin G. Penicillin intermediate, ceftriaxone or cefotaxime or cefepime. Penicillin resistant, ceftriaxone or cefotaxime or cefepime plus vancomycin. Gram-negative bacilli, except Pseudomonas spp. Ceftriaxone or cefotaxime. Pseudomonas aeruginosa, ceftazidime or cefepime or meropenem. Staphylococci spp. Methicillin sensitive, nifcillin. Methicillin resistant, vancomycin. Listeria monocytogenes, ampicillin plus gentamicin. Haemophilus influenza, ceftriaxone or cefotaxime or cefepime. Streptococcus agalactiae, penicillin G or ampicillin. Bacteroides fragilis, metronidazole. Fusobacterium spp. Metronidazole.